Warning, watch this video or you will regret it. A cough is not as harmless as you think. Have you been coughing all week? Dry cough, cough with phlegm, cough at night or early morning. Many people think it's probably just the flu, then ignore it. But did you know? A cough lasting more than 3 weeks can be the first sign of lung cancer, the leading cause of death in Vietnam and the world. More frighteningly, early-stage lung cancer is often painless, feverless, and short of breath. It develops quietly in your chest, leaving only a dull, persistent cough. And when you realize it, the tumor has spread, invading the heart, bones, or brain. This video will help you understand why prolonged cough should not be ignored, signs of dangerous coughs to be aware of, and when to go to the doctor urgently to detect lung cancer early. Don't let a cough become the final farewell to life. Take it lightly, you are risking your life. Persistent cough, a silent signal of lung cancer. Coughing is a natural reflex to clear the airways. But if the cough lasts for more than 3 weeks without stopping, don't rush to blame it on the flu or a common sore throat, because this could be the first and sometimes the only sign of lung cancer. What makes lung cancer so dangerous is its deadly silence in the early stages. When the tumor first forms, it usually doesn't cause pain, doesn't cause fever, and doesn't make the patient feel noticeably tired. There is only one vague sign: persistent coughs, especially dry coughs, coughs at night, and coughs in bouts. The cough may be accompanied by mild shortness of breath when exercising, mild persistent chest pain, loss of voice, hoarseness, may cough up blood in some cases. Notably, many lung cancer patients said they thought it was just bronchitis or the weather. They took cough medicine, inhaled essential oils, even used antibiotics, and let the tumor silently grow in the lungs. Many people are subjective because they do not smoke, thinking they are not in the risk group. But in fact, even non-smokers can still get lung cancer due to air pollution, secondhand smoke, or genetic factors. Don't take a persistent cough lightly, because it could be the last knock on the door of a weakened lung. The longer you delay going to the doctor, the lower your chances of survival. Why is a prolonged cough so dangerous? You may think, it's just a cough, it's not that serious. But when a cough lasts longer than 3 weeks, your body is warning you of something much more serious. And lung cancer is one of the leading causes. Chronic cough not only makes you tired, sleepless, and lose your voice, but more importantly, it is a symptom of physical damage in the respiratory system. It can be severe bronchial inflammation, lung fibrosis, or most dangerously, a tumor growing inside. What's worrying is that early-stage lung cancer often has no obvious symptoms other than a cough. Therefore, many people go to the hospital when coughing up blood, unexplained weight loss, feeling short of breath when walking, chest pain when taking a deep breath, or coughing. At this point, the disease has often progressed to an advanced or metastatic stage, making treatment extremely difficult. The 5-year survival rate at this point drops to only 5 to 15%. Prolonged coughing also seriously affects the quality of life. The patient loses sleep, is exhausted from coughing at night, has abdominal muscle pain due to spasms, and is mentally disturbed due to prolonged anxiety. More regrettably, many people arbitrarily buy cough medicine, antibiotics, or use folk remedies without going to a specialist. This not only delays the diagnosis of cancer, but also causes the disease to progress silently. If the cough is not accompanied by a cold, fever, or sore throat, you need to seriously check it out immediately. Don't let a lingering cough become a death knell. When should you surprise and see a doctor immediately? Not everyone who coughs has lung cancer, but knowing the difference between a common cough and a dangerous cough could save your life. So when does a cough become a serious reason to go to the hospital? Here are the signs that come with a persistent cough that you should pay special attention to. A dry cough, A cough that lasts for more than 3 weeks despite taking medicine. A cough with blood or dark brown phlegm. Shortness of breath, especially when climbing stairs or doing light exercise. Hoarseness, persistent loss of voice, chest pain, when coughing or taking a deep breath. Unusual weight loss, not due to diet or exercise. General fatigue, feeling weak, lacking energy. Even if you don't smoke, if you have these signs, especially in people over 40, you should have a chest x-ray, CT scan, or bronchoscopy to determine the cause. Some cases may have small cell lung cancer, a type that grows very quickly and can spread quickly if not detected early. It is also important to note, many lung cancer patients have lived in polluted environments, been exposed to industrial dust, secondhand smoke, or have a history of chronic pneumonia. These factors significantly increase the risk of the disease. If you find yourself or a loved one having an unusual cough, don't hesitate. Don't wait and see if it gets better in a few days. Lung cancer does not give you a second chance if it is detected too late. High-risk subjects. Do not be subjective. Lung cancer can happen to anyone, but there are people who are at much higher risk. And if you are in this group, every prolonged cough should be considered a particularly serious warning. Smokers of cigarettes or tobacco, even those who have quit cigarette smoke, contains more than 60 carcinogens, especially benzopyrene and nitrosamine. People who have smoked for a long time or are still smoking have a risk of lung cancer 10 to 30 times higher than non-smokers. But even after 10 years of quitting, the risk has not returned to normal. People who regularly inhale secondhand smoke, not smoking does not mean safe. People who live in an environment where people smoke, work in places with a lot of dust, or regularly inhale toxic gases from coal stoves, gas, are still at high risk. People with chronic respiratory diseases, people with a history of tuberculosis, recurrent pneumonia, bronchiectasis, COPD, etc. all have a level of underlying lung damage, creating favorable conditions for malignant cells to form and develop. People with relatives who have had lung cancer, genetic factors, and shared living environment can increase the risk of the disease. If your parents or siblings have had lung cancer, you need to be more vigilant for unusual signs. People over 40 years old, the older you are, the greater the possibility of accumulating damage in the body. From the age of 40 onwards, especially in men, any unusual signs such as prolonged cough should be seriously examined. A cough, a life. Do you think that coughing is just a small matter? But reality has proven many people have lost their lives just because they ignored a prolonged cough. Lung cancer is a silent killer. It is painless, not noisy, but when it speaks up, it is often too late. Remember, a cough lasting more than 3 weeks is a sign that should not be ignored, especially if accompanied by coughing up blood, chest pain, hoarseness, shortness of breath. Early examination and early diagnosis can save your life. Listen to your body. Every cough is a warning signal. Don't wait until you can't breathe to go to the doctor. Don't let the doctor be the first to discover that you have cancer. If you find this video useful, don't forget to like, subscribe, and share to warn those around you. One click from you today can save someone's life tomorrow. Your health is precious. Don't risk it for a cough. Take action before it's too late.